My name is Sister Henrieke. I'm a diabetes nurse educator at a private diabetes clinic in northern Johannesburg, South Africa. I am also a student of the postgraduate diploma of diabetes through the University of Glamorgan, which is in Wales. I would like to talk to you about feet and how to take care of them when you have diabetes, whether it's type 1 or type 2 diabetes. I always tell my patients they must learn to respect their feet. Having diabetes puts you at risk of developing complications, as having too much sugar in your blood, which we call hyperglycemia, can damage your blood vessels. When it involves the large blood vessels, we call this macrovascular complications, and this will include heart disease, stroke, or peripheral vascular disease, which means that the blood flow is impaired to your feet. If the small blood vessels are involved, we call this microvascular complications, and this can affect the nerves supplying your feet and legs. This will impair your pain warning system. Often with diabetes, both macrovascular and microvascular complications are at work. Take care of your diabetes. There have been many studies and trials done that have proved that controlling your blood sugar levels to as close to normal as possible will reduce your risk of developing complications now and in the future. To do this, we talk about the 3 cornerstones in the treatment of diabetes, and this is healthy eating, exercise, and taking your medication, whether it's tablets or insulin. Often people with type 2 diabetes also have high blood pressure and high cholesterol. These conditions can also damage your blood vessels. We recommend that you apply these 3 cornerstones of treatment to your high blood pressure and your high cholesterol. I need to mention it's very important that if you smoke, to quit. This would probably be the best thing that you could do to improve the blood flow to your feet. So with impaired blood flow and a pain warning signal not working, one can see how a small cut, a blister, an ingrown toenail, a thorn could go unnoticed. This small wound would get worse due to an impaired blood flow, and next thing happens, we have an infection, an ulceration, which is difficult to heal and which may take a very long time. Amputation of toes and feet becomes a very real threat. Check your feet every day. Make it a habit to check your feet every day. If you are unable to look at your feet, if you are too overweight or elderly or frail, you may need to get a healthcare provider or your partner to check your feet for you. Otherwise, you can use a mirror. Possibly a good time to do your daily feet checks would be after your bath or shower, when you are drying them. Pain is a warning signal to us, and if this warning signal is impaired because of lack of sensation, then checking your feet daily helps you notice small problems before they become big problems. Wash your feet every day. Everyone should wash their feet every day. But this becomes more important when you have diabetes. Use a mild soap and lukewarm water. If you have to test the water before immersing your feet in it, then use a thermometer or use your elbow. Avoid soaking your feet, as this may dry them out. And dry your feet carefully, especially between your toes. You don't want athlete's foot occurring there. Keep the skin soft and smooth. Use a good moisturizing cream on your feet every day, applying it on the top and the bottom of your feet, but again avoiding between the toes, as this will leave it moist. In my experience, men don't like putting lotions or creams on their body, let alone their feet. However, we must remember that dry feet and cracked heels can lead to infection. This infection may not heal well due to impaired circulation in the legs and feet, and then we have a complication. Smooth corns and calluses gently. If you do have corns or calluses, you really should visit the podiatrist on a regular basis. If you are not a high-risk patient, then you can gently pumice your heels and smooth corns. If in doubt, ask your diabetes nurse or podiatrist. Please don't buy those sharp debridement instruments from the pharmacy that cut and shave your heels or calluses, as this can cause wounds which will lead to infection, and then great problems will come later. Trim your toenails. Keep your toenails trimmed. Trim your toenails with appropriate clippers straight across. Don't tear them off, and we know who you are. File them afterwards and avoid cutting into the corners of your toenail. If you have neuropathy, thick toenails, or are unable to reach your toes, then you should visit your podiatrist on a regular basis. Wear proper shoe wear. If you must wear sandals, then make sure they are of good, sturdy kind. There are some brands on the market now that sell excellent footwear for you, and they're not the ugly old granny shoes they used to be. They can be quite modern and fashionable, however they do tend to be more expensive. If you have nerve damage or neuropathy, you really shouldn't walk in bare feet. Feel inside your shoes and boots every time you put them on. Here in South Africa, you might not only find a small pebble, but a scorpion or a spider. Protect your feet from extreme temperatures. Extremes of temperature are a danger to your feet. Protect your feet, even while you're on the beach, by putting sunscreen on the top of your feet and wear sandals while crossing the hot, hot sand. Remember that you may not feel as acutely as someone else and not realize you are burning the bottom or top of your feet. The same goes with heaters or fireplaces. Don't put your feet too close to them. And if you do suffer from cold feet at night, rather than a hot water bottle, please put on warm woolly socks. Keep the circulation going in your feet. Put your feet up when sitting and wiggle your toes and move your ankles up and down for 5 minutes 3 times a day. These exercises become even more important on a long-haul flight, where one can sit still for 14 hours or longer. Get up frequently and go for little walks up and down the aisle. Try to get out of the habit of crossing your legs, and I know I'm a leg crosser. This impairs circulation, and you should not wear garters or tight socks. Be more active. People with diabetes are often overweight, which nearly doubles the risk of complications. Furthermore, increased weight puts an increased load on the feet. Exercise to keep weight down and improve circulation. Undertake a daily activity program that is right for you. You may need to plan your activity with your doctor or biokinetist. Walking, dancing, swimming, or bicycling are good forms of exercise that are easy on your feet. And be sure to invest in a good pair of athletic shoes. This is very important. This concludes my 10 commandments of foot care. Take care of your diabetes. Check your feet every day. Wash your feet every day. Keep the skin soft and smooth. Corns and calluses can be gently smoothed and pumised. Trim your toenails. Wear proper footwear at all times. Protect your feet from extreme temperatures. Keep the blood flowing in your feet. And exercise and be more active. It is important for you to see your podiatrist at least once a year. If you have a small wound or infection, you should seek professional help immediately to prevent a small problem becoming a big problem. Much of this is common sense and what all people should do regarding foot care. However, when you have diabetes, good foot care now becomes imperative. Thank you.